Hello and welcome. Today, we're diving into the urinary system to understand a condition called bladder calculi, more commonly known as bladder stones. We'll explore what they are, why they form, how they're diagnosed, and what treatment options are available. So, what causes these pesky stones to form in the bladder? The main culprit is urine that becomes too concentrated, allowing minerals to crystallize and stick together. Several factors can contribute to this. One major cause is incomplete bladder emptying, often due to an enlarged prostate in men, nerve damage affecting bladder control, or strictures in the urethra. Other risk factors include urinary tract infections, foreign bodies in the bladder, and certain metabolic disorders. Now, let's talk about the pathophysiology, how these stones actually develop. When urine is highly concentrated with minerals like calcium, phosphate, and oxalate, these substances start to clump together, forming tiny crystals. Normally, these crystals would be flushed out during urination. However, if the bladder doesn't empty completely or if there's an obstruction, these crystals can stay longer, attracting more minerals and growing larger over time. Think of it like a snowball rolling downhill, gathering more snow as it goes. Over time, these crystals consolidate and harden into what we know as bladder stones. Bladder calculi aren't as common as kidney stones, but they do occur. Their prevalence increases with age, particularly in men over 50. Geographic location can also play a role, with some regions showing higher rates due to dietary habits and water quality. Individuals with neurological conditions that affect bladder function, or those with a history of urinary tract infections, are also at increased risk. What are the signs and symptoms of bladder stones? Some people might not experience any symptoms at all, especially if the stones are small. However, when symptoms do occur, they can include lower abdominal pain, difficulty urinating, a frequent urge to urinate, pain or burning during urination, blood in the urine, and urine that is dark or unusually colored. In men, pain might also be felt in the penis or scrotum. It's important to note that these symptoms can also be indicative of other urinary problems, so it's always best to consult a doctor. Diagnosing bladder stones typically involves a combination of medical history, physical examination, and imaging tests. A urinalysis can help detect blood or signs of infection in the urine. X-rays can often identify stones, especially those containing calcium. A CT scan is even more detailed and can detect nearly all types of bladder stones. Cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder, allows the doctor to directly visualize the stones and the bladder lining. While bladder stones can be of various compositions, the classification usually revolves around the cause. Common types include calcium oxalate, uric acid, struvite often linked to infections, and cystin stones. Each type may require slightly different treatment approaches. Treatment for bladder stones depends on their size, number, and the severity of symptoms. Small stones might pass on their own with increased fluid intake. However, larger stones typically require intervention. Cystolitholopaxy is a common procedure where a cystoscope is used to break the stones into smaller pieces using laser, ultrasound, or mechanical energy, allowing them to be flushed out. Open surgery may be necessary in rare cases for very large or complex stones. Medications might also be prescribed to treat underlying conditions like urinary tract infections or to help dissolve certain types of stones, such as uric acid stones. It's essential to address the underlying cause of stone formation to prevent recurrence. This might include medications for prostate enlargement or management of metabolic disorders. Preventing bladder stones involves strategies to reduce mineral concentration in the urine and promote complete bladder emptying. Drinking plenty of fluids is crucial to dilute urine and flush out crystals. Addressing underlying conditions like prostate enlargement or urinary tract infections can also help. Dietary changes, such as reducing sodium and animal protein intake, may be recommended in some cases. Regular medical check-ups are important, especially for individuals at higher risk. The prognosis for bladder stones is generally good with appropriate treatment. Most stones can be successfully removed or dissolved. However, recurrence is possible, especially if the underlying causes are not addressed. Recent research focuses on improving minimally invasive techniques for stone removal and developing medications to prevent stone formation. Studies are also investigating the role of gut microbiota in stone formation and exploring potential probiotic therapies. Continued research is essential for refining treatment strategies and improving long-term outcomes for individuals with bladder calculi.